What's particularly exciting about the new Discovery Hybrid OR is the fact that it now provides us with an interventional and operating environment that can help us maximize the cooperation and the collegiality that our physicians have already achieved. So we're extremely excited to be able to work together as a team of varying specialists within the hybrid OR environment.
It's absolutely a best practice when developing a hybrid OR to involve all players, and that would include your cardiothoracic surgeons, your interventional cardiologists, your interventional radiologists, and vascular surgeons. I think to truly get an efficient room that can be maximally utilized within our network, it was very, very important to include all those different specialties in developing the room.
We are performing any of our endovascular repairs, such as for AAA, the EVAR procedures, and also some fenestrated EVAR procedures that are AAA repairs. We're doing TAVRs, which are the heart valve replacements, and also vascular surgery has been extremely important in this room. A lot of combined open surgical with endovascular procedures that require high-end imaging, but they also require an open surgical arena.
What we're able to do is no longer move patients from one environment to another environment, but we've been able to incorporate teams together to actually maximize our throughput and maximize our efficiency at the same time that we're offering patients the highest level of quality.
Most systems are fixed, and surgery is a very dynamic process in which we have to move and basically position ourselves appropriately around the patient. With a GE system, if you need to do a surgical component to the procedure, you basically just ask the hybrid system to back away, and you basically are in an operating room. If you need to do imaging, well, you just ask the hybrid system to move into whatever place you like, and that's also a very flexible part of the system. And then you proceed with your endovascular component of your procedure. It really has given us all the flexibility to optimize our procedures in a kind of operative setting.
Well, I think the Discovery system has, first off, excellent imaging and everything that you would expect, but additionally, to be able to maneuver the gantry in different positions and locations, as well as it being a true hybrid OR environment and not being stuck on rails or from the floor, and really being able to move that gantry in and out in various ways, allows us the safety to be able to get closer to the patient. It allows us to access the chest a lot better from a cardiac standpoint, and it makes the working environment much easier for the patients. The space around the gantry, the Discovery, really allows us to treat patients that may be of larger size or higher BMIs a lot easier in that current environment in the Discovery Hybrid OR than what we would have had previously.
The flexibility and the maneuverability of the system gives us much greater capability in the operating room and really makes these complicated access patients very easy to treat.
I think if you're willing to develop a team of specialists that all treat a certain disease and figure out the best practices for that patient, whether it's endovascular, open, or a combined procedure, then you'll get the maximum use out of this Discovery.
This particular technology truly allows us to offer to the community minimally invasive endovascular procedures.
Before we had a hybrid OR, we would actually take the patient to two different settings. So if we had a patient that came in that was perhaps a trauma patient, we are a level 1 trauma center, we would typically have taken them to the interventional radiology suite and done an embolization or whatever we needed to do endovascularly there, and then bring the patient to the OR for any surgical components that they may need as well. So that required the patient to be under two different settings of anesthesia and also delay in time for treatment because we needed to transfer the patient from room to room. This room now has afforded us the capability to do all of that in one setting where it's appropriate for the patient.
procedures in the past where we may have considered doing were just too high risk to do in the cath lab, and certainly too high risk to do open. So the hybrid OR has really expanded the procedures that we're able to offer our patients.
It really is an operating room piece of equipment, not a piece of equipment brought into the operating room.